Right, my name is Dr. Free Blessing Murawa. I'm the Medical Director of Celebration Health, which is the health outreach arm of Celebration Ministries International. We are here at Mpilo Hospital doing free hernia surgeries for children between the ages of 3 months to 12 years of age. This is a program that we started a few years ago that we are continuing in partnership with the Ministry of Health and Child Care and the Department of Pediatric Surgery. Our target this week is to complete 100 hernia surgeries by the end of the week to try and help decongest the long waiting list of children in need of hernias that we know continues to accumulate over time. So our goal here is to really help the surgeons at the hospital and make sure that this list is taken care of, that children don't have to wait long waiting periods to access this surgery.
Okay. Maybe how prevalent is the condition, and from your research or your working with the hospitals, how many such kids maybe need this necessary operation?
Yeah, generally the prevalence from the data available worldwide is for Africa, it's 1 in every 10 children is born with the hernia, either a inguinal hernia or umbilical hernia. And this affects their lifestyle, although it's not an immediately life-threatening condition. If left untreated, can become complicated, affecting the child's lifestyle. Either some of them are in their school-going age, and so sometimes they wake up with pain, excruciating pain, and that deters them from going to school or attending to the other duties. It also can complicate, which can then become life-threatening. So some children actually have died due to complicated hernias. So it's always good to have the hernia taken care of as soon as it is diagnosed. Worldwide, I think the recommendation is that within a month or so, the child should have the hernia repair done. But of course, because of the limitations that we sometimes have, sometimes children go for months waiting to have their hernias repaired. So this program aims to make sure that all those children who are on the waiting list get the hernia repairs done immediately, so that there's no long waiting list. Any other children that will then come afterwards will immediately get their hernias repaired by the surgeons at the hospital. So we are very grateful for the partnership that we have had with the Ministry of Health and Child Care and Mpilo Hospital to make sure that this is possible.
Maybe ever since you started this program, do you know how many kids you have assisted?
We have done probably in the last, since 2022, probably close to 500 hernias that we've done in other various parts of the country. We're working at Salimugabe Children's Hospital in Harare, and we have a current hernia program at Victoria Staple Hospital in Manicaland, where we work with every 1 weekend every month with a group of pediatric surgeons, where they do these surgeries as well. So our aim is to decentralize, to go to other provinces, because we know that these children are coming from all over Zimbabwe. So we want to make sure that children all over Zimbabwe have access to these kind of surgeries.
Maybe as a church, what motivated you to do this service?
Well, as a church, we believe in we believe in helping others, as the Bible speaks about loving your neighbor as you love yourself, meaning that if your neighbor is in pain, our aim is to help the next person to that we relieve them of their pain. So that is our goal and our mission, also to spread the love of Jesus Christ that we know to other people through the medical works that we do in giving out these free medical services and surgical services to these children.
Okay, so when are you going to return to Bulawayo, maybe after this one?
We hope to return again sometime this year. As I mentioned, that we have a regular program that we are doing currently at Victoria Staple Hospital in Mutare. So we want to establish a similar sort of model here, because we already have pediatric surgeons stationed at this hospital. So we want to, in the near future, also establish a monthly program, so that we totally reduce that waiting list, so that every child that presents with a hernia should immediately get that hernia repaired at the hospital.
Okay, thank you.
All right, good afternoon. My name is Dr. Mushunje. I'm a pediatric surgeon here at Mpilo Central Hospital, where we are currently conducting a pediatric hernia repair camp. As you can see, people are busy. We are aiming to do 100 pediatric hernia repairs this week. From Monday, we started on Monday and now it's Friday. We've had these camps before here at Mpilo. The last one was in the year 2022. Again, our sponsor was Celebration Health. After that, we did accumulate another waiting list, and we are happy that they are here back again to give us a boost, and we are running this camp again. This particular camp, I'm excited because I have discovered that the patients that we are doing are actually the people that are coming from Cholocho, Nyamandlovu, Binga, Zaka, Masingo, Zishavane, Mberengwa, which is really the people that need such a camp. So yeah, this is what we're doing.
Okay, ordinarily when this camp is not around, what happens?
So ordinarily we put them on our elective lists. Here at Mpilo currently we have 2 elective lists in a week, but what happens is they compete with other surgeries that we're doing, including neonatal surgeries, reconstructive surgeries that take a long time. So what ends up happening is that maybe we can do only 1 or 2 of them per week, so the waiting lists really grow that way.
Okay, and maybe what's your message to members of the public who might have kids with this condition, maybe looking at the future camps that you are going to have?
Okay. So to members of the public, I encourage you to go to your nearest health center where you will be seen by the clinicians there, and then you'll be referred appropriately to a center where your child's hernia can be repaired, or where you can be in a waiting list waiting for such camps to come.
What causes this condition, and is it something that is avoidable?
So hernias are not avoidable. The children are born with them. They are born with a defect that allows contents that should be inside to visit other areas. If it's in the groin, it's visiting the scrotum. If it's in the umbilicus, it's just bulging out. But there's a hole that they are born with. And when we do the hernia repair, essentially we close off that hole that's allowing contents to come in and out.
Okay, so there is no way to prevent it?
There is no way to prevent it, and you cannot give medication, drugs or teas to treat it.
How long does maybe say one operation take when you are doing these hernia operations?
Okay. So the actual operation itself doesn't take time, 15 to 20 minutes depending on the surgeon, but when we are operating on children, the anesthetic time is also considerable because these are young brains that we're dealing with, but the actual operation takes about 15 to 20 minutes.
Thank you very much.
Salibonani, mina ngiyajabula lokho kwenzakele cause bezentwele nzima isikhathi eside labantwana bami abayi2 abafana abayi2 abalandelanayo unkululeko lo lakhi bale problem ehayina esibhono. So isibhono sankhona siyahlala isikhathi siyababuhlungu siwome sibelilithi. So namhlanje ibuyi sithola usizo ukuthi abantu abamsebezosizakala ba-operate abakhitshwe bavala isikhala lesisihlupha esiswini. So ngiyajabula, ngiyabonga khona okwenzakele.
Okay, so ngifuna nje ukuthi kwina kade kubahluka sibe bekwanisa ukudla kumbe besingangadla kube kuhlungu kwina kade kuhlupha stereke
bangahlala isikhathi eside bengadlanga impeleni yaba-attracta futhi yababona sana siyawoma sibeqa sibe buhlungu yabangasakwanisi khona ukuhamba besephonga ukukhothama kuphela yabangasakwanisi khona ukuthi emuve impela usuyenza ukuthi ukuphakamise. So ngibuye lapha esibhedlela bangisiza babisela isibhono sangathe so bathi bafuna ukum-operator bemkhiphi bevala isikhala lesisihlupha. Hayi ngalokho kwenzakele.
Sanibonani, mina nguYolanda Sibanda, umama kaWarren Temkos hlala Wori. Warren ube le problem yehernia. Ihena yakhe ibim-attack ku-right side, so ibimthwalise nzima kakhulu okokuthi nxa ibimqalile vele ube ngakwanisi ukwenza lutho. Wafika esikhathini sokuthi ube ngasakwanisi ukuya ngaphandle, sechama nzima mayefuna ukuchama kube nzima ukuthi achame. Then sasesibuya eMpilo asebesinika umuthi ukuthi ngimathise umuthi onjani, then wasusiza, but bekufika isikhathi sokuthi iphindi ivuke futhi ihene yakhe up until saze safonela esibhedlela besincedisa ukuthi i-date operation yakhe isitshintshile, namhla besibuye ku-date operation yakhe. Hayi kusebenzeke kahle because la even noma esalele, but I can tell ukuthi kule change. I'm happy kakhulu ukuthi sengincedakele because after 1 week bekumele ngidinge imali ukuthi ngithenge lo muthi. Sometimes bengize ngiswele imali yakho ukuthi sithenge umuthi, and then happy kakhulu ukuthi operation yakhe iyenzakele namuhla.
Okay, so ngicela ukuthi angifuni ukubonga bonke abakhipha izimali ukuthi sikwane kuba le operation le.
Okay, bengifuna ukubonga bonke abakwanisile ukuthi besisize singabomama ebantwaneni laba abatholileyo usizo lolo lanamuhla. Siyabonga kakhulu. Angathi bengakhontinya bengadinwa beqhubeke benceda la kwezinye indawo. Ngiyabonga.
That's it. Siyabonga.